I'm Kristina Hawes, the Regional Health Education Manager at U of R's Center for Community Health and Prevention. Thank you for joining us for the Promote Health, Prevent Cancer Initiative's Cancer Prevention Awareness Month talk. The Promote Health, Prevent Cancer Initiative is a partnership between the Center for Community Health and Wilmot Cancer Institute in order to ensure that everyone within our region, both in Monroe County and beyond, has access to cancer prevention and screening, education, and programming. Cancer has many causes, but there are things that you can do in your daily life to help to reduce your risk. Avoiding nicotine use or stopping nicotine use greatly reduces the risk of several different types of cancer. Having a healthy diet and being physically active also reduces your risk, as does practicing sun safety by doing things like wearing sunscreen or avoiding tanning beds. Following cancer screening recommendations can help to find cancers early when they are most treatable and beatable. And in some cases, screenings can actually prevent cancers. But the most important thing for you to know in order to understand your cancer risk is your family history or your genetic makeup. Here today to talk with us, we are very lucky to have Dr. Michelle Shayne. Dr. Shayne is a medical oncologist here at Pluta Cancer Center. She is also the clinical co-director of the Judy DiMarzo Survivorship Program and the director of Hereditary Cancer Screenings and Risk Reduction Clinic at Wilmot Cancer Institute. Thank you for joining us, Dr. Shayne.
Thanks so much. Thanks for having me.
So first, can you just tell us the importance of knowing your family history or your genetic makeup?
It's very important, although not everyone does know their family medical history. But wherever possible, it's good for people to ask relatives. There was a time when cancer wasn't discussed very much in families, and so to revisit that with people now when you're interested in learning more about whether or not you qualify for genetic testing, it's a reasonable thing to ask family members what they know, what they remember, and as much as possible to put together as comprehensive an understanding of family medical history with respect to cancer.
Yeah, what would I expect if I come in for genetic testing?
Yeah, so we have people who are practitioners in genetic testing. We have nurse practitioners who are very well versed in this, and we also have genetic counselors. And what they do is they'll meet with patients, ask a lot of questions about family medical history and also personal medical history as it pertains to cancer. They also explain what happens when a genetic test is revealed and the purpose of it. How is it useful to have the testing done? What will a negative test mean? What will a positive test mean? And how it can impact surveillance going forward. And also we have strategies for reducing risk for developing malignancy in certain instances, things that include surgical risk reduction practices and also in some cases medical practices that can reduce risk of cancer.
So is it a blood test? Is it a swab? What do you do?
It can be either.
Who is genetic testing right for? Should I come in and do it? Should I have a family member come in and do it? Who should be doing it?
That's a great question. It's not for everyone yet, but right now certainly a person with a history of cancer, him or herself, some people have multiple cancers in their medical history. People who have striking family histories with multiple malignancies, and we sort out the rest. They're usually constellations of malignancies, meaning breast cancers, ovarian cancers, skin cancers, prostate cancers, sometimes colon cancers. We know how to put them together in various syndromes. That helps to figure out which test is appropriate. And sometimes there are also panel tests, so multiple genes that are screened for at the same time.
How is this covered? Who covers the payment for genetic testing? Is it something I do out of pocket? Does my insurance pick it up? How does that work?
Yeah, for the most part, if it's appropriate, and there are a variety of criteria that need to be met for insurance to cover it, but for the most part, if those criteria are met, then insurance does cover the cost of the genetic testing, which can be quite expensive otherwise.
With that, how do I find out more information? Where do I go?
Well, you can contact us at the Wilmot Cancer Institute, the Hereditary Cancer Screening and Risk Reduction Clinic. The other thing that you can do is talk with your primary care doctor to see whether or not it makes sense for you to have genetic testing, and then your primary care doctor can place a referral. You can also talk with, if a person has a history of malignancy, him or herself, the individual can speak with their medical oncologist, and medical oncologists can also place a referral to our clinic.
With genetics, what kind of lifestyle choices make sense if you have a genetic history of having cancer? How can you reduce your risk?
Right, some of the things we recommend in our clinic to reduce cancer risk, some of the lifestyle recommendations are things we actually should all be doing, whether or not we're at risk of harboring a pathogenic mutation or not. Things like regular exercise, maintaining a normal body weight lifelong, exercising caution in the sun, things like eating a healthy diet. I know that sounds very vague and broad, but there are more specifics that we get into, and it's also a bit of a moving target in terms of research right now. There's a lot being done to understand some of these lifestyle variables, but these are just a few that we talk about with all our patients. People who are at increased risk of colorectal cancer, we discuss consideration for aspirin to be taken on a regular basis, but we also mention that since taking regular aspirin can be associated with increased risk of bleeding, I always tell my patients to discuss aspirin as a risk reduction strategy first with your primary care doctor as well as your gastroenterologist if you have one before embarking on aspirin. Things like exercise, healthy diet, a lot of these things are sort of intuitive and we've heard for many years, but they do work. Research has demonstrated that a lot of these interventions on the lifestyle front are associated with reducing risk of developing cancer.
Well, thank you very much for your time today.
Sure.
And thank you for watching. If you liked this video, please make sure to click the like button, give us a thumbs up, or share this video with your friends. For more information about anything discussed today, please click on the links provided in the box below. And until we see you again, be happy, be healthy, and be active.